Today we're going to focus on lower leg problems. For instance, osteoarthritis of the knee, shin splints, ankle issues, bunions, flat feet, that type of thing. But first, let's take a look at the anatomy of the lower limb first. Come on over here. Now, Kira has a perfect example of flat feet. As you can see, her arches are quite low on both sides. And we'll take a little bit of a close-up shot later on to focus on that. But what I really want to take a look at first is the alignment of her legs. Now, because Kira's feet are a little bit flat on the inside, you'll notice that there's a bit of a shift of her knee inwards and her ankle inwards as well. Just to illustrate that a little bit better, I'm going to use this piece of string here. And what we see is that Kira's foot, the center of her foot should line up in terms of her knee and hip to a certain degree. It's not perfect, of course, but as you can see, when you illustrate an alignment like that, it really becomes quite noticeable in terms of how much her knee is torqued or kind of twisted to the inside. And a lot of that has to do with the flat feet. So let's just illustrate what happens when we move towards more of a normal arch. Okay, so that's what a foot should look like in terms of a little bit of a better arch. And let's put the string back to illustrate what it looks like. Center of the foot and the hip. And you can see how much better that is. Now when Kira drops her ankle or foot and it flattens, you'll notice that it torques inwards again. So of course what this does, it produces a lot of issues with alignment in terms of the lower leg. And when you have alignment issues, very similar to if your car tires are misaligned, you'll have excess wear on one side or the other. As a result, with the knee, instead of going up and down, when it's flexed and then going upstairs, going downstairs, the kneecap tracks off center, almost on a bit of an angle like this. And this produces excessive and quicker wear and tear issues. So you may have relatives who are a little bit older or spouses having issues, getting up from a chair, up and down stairs, and that's because of typically osteoarthritis or wear and tear in the knee, and that's often produced by the fallen arch. So again, if we maintain a good arch, it maintains or corrects the alignment of the knee, better tracking, less wear and tear issues, so a longer lifespan in terms of the knee joint. Okay. Now, this misalignment also produces issues with respect to ankle issues, especially if you've had chronic ankle issues in the past, for instance, perhaps from sports, if you keep twisting the ankles, that type of thing. Once the ligaments are stretched out, again, with the fallen arch, it produces even more of an issue as well. So, shin splints is another symptom I see a lot of in my practice, and that has a lot to do with pain along the shins here, or even fatigue along the back of the calf. And that's because the muscles in these locales have to go into the foot, and the back of the calf goes into the Achilles tendons, and some tendons go to the bottom of the foot, that type of thing. So the easiest way to put pressure on muscles, not just to twist it, not just to traction it, but traction and twist it, and that's what produces quicker injuries. Okay. In terms of bunion formation, in terms of along the build-up, in terms of a large increase in bone density on the inside of the big toe, think about it. Again, more of a shift towards the inside of the foot with the fallen arch that produces increased load on top of the big toe, which in turn produces increase in deposition of bone along those areas because your body wants to try and reinforce it. It's almost like putting concrete against a wall that's having to deal with more and more stress, trying to reinforce it. Okay? So in review, issues with the knee, especially osteoarthritis if there hasn't been injury before, even if there is an injury before, it's even faster in terms of degeneration. Shin issues, calf issues, a lot of leg fatigue in individuals with fallen arches because the muscles have to work much harder to do just a regular job. That's why we'll often see in change of seasons, for instance, especially summer and spring to summer, many more people are wearing flip-flops, open shoes, much less support than wearing closed shoes or a running shoe. And as a result, see many more injuries in terms of foot problems, shin problems, and knee problems that aren't even related to increasing sports during the summer. Okay. In the next video, we're going to take a look at what the orthotic actually does, and is it really necessary? And if it is necessary, what should you be looking for in terms of how you should be measuring for an orthotic? We'll talk to you soon. How do you know if you have flat feet? Well, a lot of people actually think they don't know they have flat feet, but there's some red flags you can take a look at. For instance, if we take a look at this shoe, this is the outside of the right shoe. You'll notice that you'll often see an increase in wear on the outside of the heel, and that's because when you have a fallen arch or flat feet, you'll compensate, so you'll walk more on the outside of your foot, so it'll tend to wear a lot faster. Okay. Don't forget we saw before how the alignment issue tends to be much worse when you have a flat foot, and what we're trying to do overall is to bring you back to neutral. Okay. Now, can you stand on this for me? Okay, good stuff. Actually back up a little bit. All the way back. Okay, just stand on this piece of paper for me. That just illustrates a little bit further. Good. Now, once again, the arch is falling onto the inside, and what we're trying to do is bring it back to neutral. The only way you can determine if you have flat feet or fallen feet is to actually stand, and when your arch disappears, relax, you know that you have a fallen arch. If you just take the weight off your feet, go ahead, your arch actually becomes quite normal. So people will always look at their, look at your foot from the palm of your foot without falling over.
Yes.
When you look at your foot, you lift up, so, oh, I don't have flat feet. It's because your arch typically starts to come back when you're non-weight bearing, which makes sense. It's only when you're standing and your weight is on your feet that your arch collapses. Okay. Now, in these individuals, an orthotic is basically a terrific thing. And just to give you an example, they come in different varieties, many different styles. This is a 3/4 length one, so it only goes to this part of the foot. And that's all you need, because that's where the orthotic is sporting, everything behind that. And sometimes you'll see orthotics going all the ways to the front of the toes, and just like an insole. And I recommend those for individuals who spend a lot of time in one particular shoe, because for it to fit properly, you have to kind of trim it, and once you trim it for one shoe, it's not going to fit another. So if you're thinking about one orthotic, just get a 3/4 length one first, because that's much more flexible in terms of just popping it in and out of different shoes. Now it looks very thick, and that's a bit of a deception, because if I rotate it, you can see that it's quite hollowed out, and that's so that the heel gets locked into it, so it doesn't move, so you don't have to worry about it sliding. So although it looks really quite thick overall, again, it's not, it's quite thin. And just to demonstrate, if we put the orthotic underneath the foot, okay, corrects the alignment much better compared to, again, to the left foot. And if we take the orthotic out, the arch collapses again. Okay, so for individuals with flat feet, what it does, it corrects the alignment of the knee. Just put this back underneath. Shifts the weight so it's over the center of the foot, better knee tracking. If you have a history, family history of knee issues as you get older, then it's tremendous. Releases the amount of stress on the muscles, so